Welcome to part 2 of the Electronic Medical Record version 3 Build 2 Features Upgrade webinar. Moving into the arena of orders with regards to lab and radiology orders. One of the new features for the lab order is the ability of defaulting the current computer date and timestamp to your specimen collections. So when you go into the collection button after you have collected the specimen from your patient, instead of having to manually key it all in, you can simply click the icon and it will populate the current date and time for that specimen collection. Also, with regards to lab and radiology orders, once it has been completed and the status changes to ordered, it will now include the method of completion, whether it was printed, e-sent, or faxed, based on how you completed the requisition for the patient. For those of you that are doing eLab, there's some setup behind the scenes for what is required, whether that would be LabCorp or Quest or whatever the vendor is requiring, such as the account number. And these settings will default then into the HL7 interface as appropriate, based on the location and the attending provider on the order. You can get more details on this if you watch the lab interface video series. Some additional enhancements with regards to lab, especially the eLab. There's numerous new properties for a new lab called iCore Plus. We also now do allow barcoding support. There's some new dimensions available for label printing if you are using the Dymo label printer for your specimen tubes. The patient contact icon is now available. Now that, of course, is available throughout Prognosis, wherever you see the little telephone. And that is the user-defined template with regards to the patient details that you want. And then, of course, when you mark your lab ready to send, this is a new provision to accommodate bulk sending eLab. So instead of e-sending each one, you can mark them ready to send and then send them all in bulk to that particular vendor. Now, moving out of the order, but looking at the results. And again, this applies both to lab and radiology. Even though our example is primarily demonstrating lab work, the interface is exactly the same on the radiology side. You now have a submenu option when it goes to viewing your results. You can review them either at an order level or at the matrix level. Now, the matrix always existed before, but it was more at the historical view only. So by providing you the submenu options, you now have an easier opportunity of going in and viewing the matrix. And then when you choose that option, you have the additional filters available to you to look at it at an order level, which would be all inclusive of multiple tests, or looking at it at an individual test level. You also can specify the number of days. And within all of this viewing area, the user interface has been redesigned with color coding and with all these new icon symbols, so that at a singular glance, you can very easily see the different lab results and how they have changed through time, whether they've gone up or down in their numerical value. If there are comments associated, you'll have the different notepad icons, the color indicating whether it was at an order level or a test level. You have the graph available where there are numerical results. So if you would prefer to look at a graphical view as opposed to the numerical or text view. The yellow shaded background indicates that the doctor has not yet reviewed those results, whereas once they're reviewed, they will show in a clear white background. So you get a wealth of information now by just glancing at the screen through the use of the color coding and the different icons, instead of having to point and click on so many different hyperlinks as previously. Now moving to the document list, which includes your results, but also anything else that has been attached to the chart, as well as system-generated progress notes and procedure forms, there is now a preview button available. So instead of having to double-click the attachment and scroll through to view the content, you can now open it in a separate window and see it full screen. A nice new feature with regards to the Attach Center, when you are attaching documents that are multi-page, you now have the ability of automatically splitting them into individual documents. This is very advantageous when you're getting a bulk file. Let's say a vendor sends you a lot of faxed lab results, but there's 20 patients included, and each of those patients has multiple labs. So it was very inconvenient previously If it was scanned in as a singular document, you could not intersperse each page appropriately to the appropriate patient. So now we have a new button at the bottom called Split that will give you an option of splitting it into different page ranges, or if you want to split it all, then each individual page within that scanned document will become its own separate page. When it does that, the system is going to keep the same name. So as far as the nomenclature is concerned, as you see here in our snapshot, the original is retained, but then each of the subsequent ones that it is split into will have a numerical suffix added on. _1, _2, _3, and so on. So you will always still retain that original, but then you will have the individual split ones that you can then appropriately attach as needed. When you do it as a range, instead of just a numerical sequence of _1, _2, _3, you'll see the actual page number that is included. We see here in our example of document 5411, we did a split of only pages 3, 4, and 5. So we kept page 1 and 2, and if there was anything after page 5, it remains available in the home document, but pages 3 through 5 only have been split into its own. So either way, when you are getting those bulk scans now, you have the ability of being able to split them as needed so that they can be attached to the appropriate charts. Also, with regards to attachments, specifically with regards to radiology results, and this does have a meaningful use impact, there is a new attach type drop-down on the attach scan screen. This would be applicable whether you're doing the one-touch direct scan or the bulk attach scan. Whenever you choose attach type radiology result, you now have the attach type field where you must specify whether it is an image, a narrative, or a combined image and narrative based on whether it includes the scanned image or not. Now, another substantial enhancement to the version 3 upgrade is with regards to the prescription module. Primarily, this was due to a SureScript upgrade. They, of course, are the clearinghouse that handles all of the e-prescribing. So as a result of that upgrade, there's been some new functionality added, as well as some UI changes to the screens within. First of all, starting with our pediatric dosage calculator. Previously, it would default to a standard weight for all refill request encounters. But now the logic is going to pull the actual weight from the patient's last encounter instead of a standard weight. So that will help the dosage be more precise for your specific patient. A new label change on the prescription screen, similar to your in-house and sample drugs. When you are prescribing a drug that is available over the counter, the label will now indicate that with the acronym of OTC. With regards to multiple location practices and e-prescribing, this is a nice upgrade for those of you who have ran into situations where the primary location demographics is what was associated with that ERX summary. Within prognosis, every practice has a primary location, which is location record CL for clinic location. And that is usually the predominant driving location, regardless of if you have satellite locations or not. And sometimes the doctor may be working at one of those satellite locations and writing a refill or an e-prescription from one of those other locations, but yet the summary would always still show the primary location details. We now have the provision for each location with its own individual specific credentials to be printed on those prescriptions. This requires that each location be registered through the SureScript admin console. Our engineers take care of that for you, but you would just have to let it be known which physicians need the ability of doing e-prescriptions from each of those different locations that they service. That way the registration, as you see here, will cross-reference that doctor by location with his DEA and state license number accordingly. And then SureScript will assign a registration number for e-prescribing, and that is what then will control the demographics that are associated with the e-prescription. Package size dispense quantity, which is a SureScript requirement when you are e-prescribing. Previously, you only had the predefined options that the First Data Bank provides. Now you also have the ability of free texting it. So because SureScript requires the bulk when you are dispensing a prescription, If it is a drug that does not otherwise come in bulk, and therefore there were no choices before, you now have the option, and it will default to whatever the quantity already is and the dosage, whether it's a tablet or a capsule or whatever the situation is. The user interface has had a couple of label changes with regards to the refill. When you go under the menu option CPOE refill, outside of the context of a live encounter, the label attending doctor will now identify the provider name that is displayed, and that is based on, it can be changed. It's obviously going to default to the last attending doctor of that patient, previous prescriptions, but now you can change it. So if maybe Dr. Cooper originally wrote the prescription, but now the approval of the refill is Dr. Koothrappali, it can be changed for the refill request. And continuing with that refill request, of course, when you do a refill through the CPOE refill option, it automatically creates a dummy encounter known as a refill request encounter. And typically you should not see those if you complete it all in one transaction. You go through CPOE refill, which opens the encounter. If you complete it with the prescription details and then send it off, the encounter automatically closes itself, so it does not get stuck open. It, of course, remains open if you break that transaction flow. It is the logic here that has changed based upon the patient's previous refill request and who that attending doctor was, and whether or not there is already an open prescription for the patient for that doctor, or if it is a different doctor. Because of this logic change, you can now have multiple refill request encounters for the same patient if it is for a different provider and or different specialty. When it comes to the electronic refill request from SureScript that comes into the attending provider's inbox, and they're then able to either approve or deny, there is now a functionality available that you can have multiple recipients, such as your nurses or your medical assistants or other doctors, to receive the same refill request. So procedure-wise, if you have a workflow in your office that permits other people to approve your prescriptions, they will get that same reminder request refill from the pharmacy. And if it goes to multiple people, whoever approves it or denies it first, it will notify the message across the board to everybody who got a copy of it. So if you go in and try to refill it and it's already been completed, you'll be notified that it is not applicable for being modified because it has already been approved or denied by somebody else. Sticking in the context of refills, for any DEA class, you'll notice here at the bottom that this is property specified. So between class 0 and 9, you can specify what properties you want this logic to apply to. The way the calculation works in prognosis when you are writing a prescription is it calculates based on the dosage and the strength and the number of refills when that patient qualifies for a refill of that drug. Well, sometimes the patient may be on vacation or going out of town or whatnot, and he needs to refill that prescription early. So the calculation used to have to manually be worked out. Well, now the system will automatically work it out so that if you are doing a refill request, as we see here through our current medication screen, even though it is prior to the up to date, the fill date on the new prescription will become that up to date, and it will then recalculate a new up to date on your current meds to reflect the earlier fill date. That way you will always have an accurate counting as to when the refills are needed again or not. Now, I mentioned a lot of these changes were due to a SureScript interface change. Some of those were just aesthetic changes within Prognosis itself, but because of the interface at SureScript also being upgraded at the same time, there are some new functionalities available to you at a broader level than beyond just Prognosis. So like when you go into your pharmacy search, SureScript has now made some label changes with regards to whether they accept new prescriptions and controlled substances, and now actually is spelled out new or controlled substance instead of previously where they used abbreviations. There's also a couple of new layers of clinical information messages available to providers once you're enabled with that secured messaging end-to-end. These, of course, this is a snapshot that you don't see in the application from the provider e-prescription master. But when you are being certified through the SureScript console for your different e-prescribing features. This is what the engineer is working with in conjunction with what they're setting you up with at SureScript. So they have these new options available now for clinical information messaging, clinical information events, as well as the new patient savings, which is a coverage feature. With regards to this also, at the medication history level, it is now PBM specific. Now PBM stands for Pharmacy Benefit Manager, and there are multiples of these throughout the country. There may be multiple PBMs per patient. So when the eligibility is being verified now, you will now have that indicated in your eligibility screen by a drop-down pick list. And then the prefix or the identifying indicators is just going to be unique for the Pharmacy Benefit Manager. But as long as that number is unique, then that indicates the benefit information being returned, and the medication history being returned is specific for that PBM. You have an option then of verifying individually PBMs or all of them. So in the drop down, as you see here, it says all, and then there's a yellow category for each new PBM and what their details are with regards to the dates of service and whatnot. So when you are trying to verify the current patient's medication history based on all of these PBMs that are feeding, you can make the determination as to which one is valid or not and which drugs you would like to add into prognosis. Along the same lines is the eligibility as to benefits. Now this has a meaningful use impact because this is where the drug formulary comes into play. With regards to eligibility, the button on your prescription screen will now show red when the eligibility is not found or mismatched. The label is white when eligibility is verified. When it is red, that means with regards to meaningful use, you are not getting compliance credit. Now that of course is covered in more detail at the meaningful use level of videos, but here at the prescription screen itself, the importance for you to know is if that label is red, then that means one, there was no eligibility found, and the tooltip will explain this as you see here in the lower right. And the reason there was no eligibility found, if you click the details, you'll see here on the left-hand side that it means the patient doesn't have insurance, or the patient has insurance but doesn't have pharmacy benefits in their plan, or the patient details could not be matched up based on name, date of birth, gender, and zip code. So in either of those three scenarios, you have the option of verifying the data and then fixing it and clicking the retry button, or of course ignoring it. You've also got a scenario where the tooltip is going to say no eligibility selected as opposed to not found. And this is that scenario we just alluded to earlier with regards to multiple pharmacy benefit managers reporting. Or there may just be multiple occurrences of this patient's data, and you need to verify which one is accurate for today's encounter and which one you want to apply. So then by selecting one of these radio button choices and clicking OK, that will turn the button white and give you the details from that pharmacy benefit manager. Another new feature of the SureScript interface is patient savings details. This is a new level of detail within the eligibility portion, and it indicates when the patient has certain cost savings benefits, which may determine how you actually write your prescription. When such cost savings are applicable, there will be a hyperlink on the prescription screen which opens up those benefit details. And you see here that it shows over here in green what their savings could be. Now there's some setup required here that would go through our implementation team or technical support if you're a live client. It's only available for you once you have been enabled for the end-to-end secured messaging. There are two types of messages, as we just saw in that previous example, based on the patient's prescription history and their eligibility. One, it can tell you whether or not they have a 30 to 90-day plan, meaning a 90-day prescription may cost the patient less than a 30-day with refills, or if there's a generic alternative available. It will inform the provider of the less expensive drugs. And then within the action drop-down, when you choose to use this feature, you can indicate the action you've chosen as to why you're changing your prescription. And then the last big upgrade with regards to SureScript is called the Analytics. Now this will be a brand new icon on your prescription screen. It is enabled by a property. So if you do not see this icon once you get the upgrade, that's an indication that the value of this property is set to no, which means do not show this function. If you want to see it and this property value is set to yes, then on your prescription and on your refill screen, you will see this analytics icon. This RX helper, as it is labeled, is a generalized source of information. Now, it defaults from the current encounter you've selected as far as the patient age, gender, geographical location, and the diagnosis details. But the statistics that are provided are not patient-centric. So this is a tool to help you determine whether or not your diagnoses substantiate the drugs you're prescribing, or nationwide, based on these diagnoses and this type of patient, what drugs are other doctors throughout the country prescribing for those ailments. And you can filter for different results, of course. Now, again, it's going to default to your gender, your age, and your ICDs on the selected encounter. But you can filter differently when it comes in here to the RX helper. You can change it to filter on only the current diagnoses on this patient, meaning at least one of the diagnoses on your patient's assessment has to exist. You can filter geographically based on all prescriptions nationwide, or only your specific state, your specific clinic, or your specific patients, meaning you're the attending provider. So you can filter nationally, state, or even locally for your own practice, your own self, and your own patients. Maybe you've treated this range of diagnoses 100 times, but you forget what you always prescribe. You can filter gender-wise, male only, female only, or both, as well as age-wise. So this helps you, again, get some very specific details, trends as to what are the top prescriptions for this diagnosis range, or for these diagnoses, for males with this diagnosis, for females with this diagnosis. What are the most common drugs, and how many times has that drug been prescribed for this diagnosis, and so on. So it's a nice opportunity to see if what you're prescribing is aligned with national standards, or if maybe there's other options that you could be trying with your patient. Now, moving out of the static EMR itself and going to its subsidiary applications, such as our portals and our mobile apps. First, as regards patient messages to the clinic from the patient portal. Now, in part, this does have a meaningful use implication. However, the specific enhancement that we're going to talk about in our upgrade is not got a direct impact on meaningful use, because in stage 2 for MU, the messages must go to the doctor. The enhancement feature here is with regards to having a general patient support person at the clinic that is not the physician. As you see here in our CL location, which is our primary clinic location, there is the designated patient support role. And until now, you could only have one individual assigned there. Well, with the new functionality, we now have a role that can be assigned to any other user in the practice who needs to share in having those incoming messages come into their mailbox. Some of you may already have set up a process such as front desk, where everybody in the office takes turns logging in to process those messages. And that's completely fine if that is working for you. Or you can now take advantage by assigning specific users, and then a copy will go into their inbox of prognosis, as opposed to somebody having to individually log into a general delivery. When it comes to defining user logins to the portal and communicating that to the patient, we now give you an option. The legacy behavior, which is still the default behavior, is that whenever a new patient gets registered in prognosis, if you enter an email, the patient automatically gets this generic email with a generic user ID and password. And by generic, I mean the system creates a user ID and password for the patient based on internal algorithms. In order for the patient to view what that password is, however, they get an email in their personal outside email, and it has a PDF attachment that is secured with a password. That password is their date of birth. And sometimes the patients get confused because they think their date of birth is now their password to the portal when it's not, or they don't know how to open this. They miss the free text in here telling them that the password is your date of birth. So there's an option now that if you don't want to do it that way, instead of the patient getting an attachment password protected by their date of birth. The body of the email itself will include their user ID and password. So this template of the email that goes to the patient is customizable. You see in the background the standard one that is present in everybody's database, and we've circled in pink there the second bullet point that is instructing them to open the attachment. They need to enter their date of birth. On the foreground here, though, we've customized the template, and we've used these two new tags: username underscore user underscore ID, password underscore password underscore. If you customize your template by using these tags and these tags only, that will supersede the default logic, meaning the patient will get an email, a singular email in their mailbox without an attachment, and it will clearly state right there in the body of the email what their user ID and what their password is. Along with that option, you also have one step further where you can define your password rule, that whether you want it to be the date of birth, then it will always be unique for each patient and doesn't have to be in the body of the email. So it's kind of encrypted in that regard, and you're not directly including a password, which a lot of people do not like to do. Or you can actually hard code a password in here. This is fine as well, because no matter which way you do it, the password generated at this level is only good for one use, and it always immediately expires the first time the patient uses it. So some practices may adopt system-wide or clinic-wide that every user's initial password is going to be password 1 or temp1234 or something like that. So if you would like to do that, you can predefine that in this property, and then when the email goes out, it will always say your password is password 1, or your password is enter your date of birth, whatever the scenario is. That again only works in conjunction with the new feature of customizing the template to use these new tags. If you don't do either of those, then the default behavior remains, where they will get a PDF attachment that is encrypted by their date of birth, and the PDF will include a unique system-generated value. Earlier in part 1 of this webinar, we discussed the new patient type, Discharged, which can be assigned under the Patient Register Other Info tab. That prompts an alert when you're trying to book an appointment within EMR. It also carries over here to the portal if the patient attempts to log in, which of course would then force them to contact the clinic. Another function that is now customizable at a property level is what level of basic details you allow your patients to modify online. Now, a lot of this is covered more extensively in the patient portal webinars and videos themselves. We're just, of course, now covering the enhancement feature of the upgrade. So this is an existing property, and of course, you have to have already decided that your patients have this access to begin with. The extension now, though, is it has gone beyond a yes-no property to where it now accepts specific values of PACO. So if you want to allow them to update personal details, such as their name, date of birth, social security number, or their address, or their contact info, which is address, phone number, email, or their meaningful use fields only, or any combination of those. Maybe you want them to do their meaningful use because they're uncomfortable answering those questions on the phone or in person, so you tell them to go online and do that so they feel more private. Or maybe you want them to update their name in case you misspelled it, but not the address because you want to control that, or whatever the scenarios are. Instead of just either yes they can or no they can't, which was an all or none situation, you can now be specific in what permissions you allow them to update without having to contact the office. For those of you using patient forms on the portal, where you have the patients fill out their paperwork online before they come into their visit, the buttons at the bottom and the workflow here for your patients has been a little streamlined. Previously, they had two buttons, submit and save. So you would have to train your patients on every individual form, fill in the data and save it, and then submit it, because that is what would send it over to the encounter screen in the office. But then if your patient had to fill out multiple forms, they would have to go back into the next form and do the same thing, and it was a little tedious to train your patients. So what we've done now is combined the save and submit into a singular button called submit. So when they type in the form, it automatically goes over to EMR. But then we've added a second button called Submit and Next, which means save this data, submit this form only, and immediately bring up the next form. This way the patient doesn't have to go back to a menu, maybe select the wrong form or select them out of sequence. You can now determine the sequence of the forms so that your patient has an automated workflow where you're in effect forcing them as to what forms to complete. Now, it's only as good as them hitting the Submit Next button. And obviously, if they've only got one form, then they won't have that option. It'll be disabled. But when there's multiple forms that you've put on the portal, they will have the choice of submitting and then manually choosing another form, or Submit and Next, where it will immediately come up in an auto flow. And in both examples, the data will save and transfer to EMR in one click instead of having to remind the patient 2 clicks. And with regards to what I just alluded to on determining the sequence of your forms, you have the ability now of defining that patient form menu. As to the disclaimer, meaning the instructions you want the patient to read, the title of the form, and any instructions you want them to follow. So these are properties that are available under the configuration menu, and you can free text in these values, and whatever you type here is what the patient is going to see on the portal. For those of you that do allow your patients to request appointments on the patient portal, there is now a means of limiting or restricting which doctors are available, so that if the patient is attending a practice with multiple doctors, but some of them do not want them booking appointments online, they require them to make a phone call or a direct human contact, then in the provider master for each individual scheduling provider, there is a new flag for patient portal scheduling or not for scheduling. And you can determine there if that physician is going to be allowed to have appointments booked to them or not. Now, the same is true with your resources, whether human or non-human providers. They also have the for patient portal scheduling flag. So unless they have the for patient portal scheduling selected, they will not exist as an option, and therefore the patient will not be able to request an appointment for that physician. Patients now have the ability of printing their progress note from the portal. Previously, they could view it online, but they had no opportunity to print it. So now the print button is available. Also, radiology attachments will be available for the patient to view online. Of course, this requires you giving them the ability of viewing the results. And when you attach it, we talked earlier about the new attach type. You do need to attach it as a radiology result so that they can then view it online. We also talked earlier about the e-payment on the copay screen. That is for your users within the practice collecting money at the time of service. Patients can also make e-payments from home. So this is probably more relevant for those who have the billing module. If you don't use our billing module, you don't really have any means for them to put e-payments in the system, so this would not be available. But when you do use our billing system, they have an option of viewing their statements, deciding if they want to pay the current outstanding amount or the last outstanding amount based on if the last statement occurred 30 days ago, but they just had new charges last week. So whatever provisions you have decided locally, they have the opportunity of going through the portal, selecting the billing tab, and then doing the e-pay. So it would be just as similar to if they go online right now to eBay or any kind of an online shopping where they use PayPal or something like that. That is what this is giving them the functionality of doing, paying their prognosis bills electronically, and then they can print their receipt. Referring doctor, now that was all with regards to patient portal. We've also got the referring doctor portal where you allow your community doctors to have logon access to patient data in the EMR. So a change here now is with regards to viewing letters and documents and attachments. There is now going to be an attachment available similarly to what we talked about up above, where the patient can view the attachment on the progress note. The attachment here is also going to be available to referring doctors. They can also print the progress note from the referring doctor portal, just as patients are able to. So this way, if you have referring doctors using your portal, instead of you providing these letters through letters out on every discharge of every patient, they can just log in and view them and print them themselves. Now moving out of the portal realm into the mobile realm, specifically the iPhone. For those of you who choose to use the iPhone app, the ability of doing a quick register is now available. So when you go into the new patient registration, now you have an add new icon available, and which then will of course walk you through the basic required fields. Now it's going to be the same basic required fields of a quick register inside Prognosis EMR. This is when, for instance, you're doing a walk-in or you're adding on a new patient, but you don't want to stop and create the entire chart or get all the demographics. All that's required basically is name, date of birth, and gender. So that feature previously was not available on the iPhone app, and now it is. The IMO search we mentioned earlier is now a system-wide feature. Wherever you have assessment, it is also added now to the iPhone. So even if you use your iPhone now, you are able to do the ICD-10, ICD-9 crosswalk and get that pre-transition education going if you so desire. And now wrapping it up with specific enhancements relevant to the meaningful use piece of EMR, the summary of care label has been changed. Previously, it was called transition of care, but it has now been modified to summary of care. Summary of care is a meaningful use requirement with regards to transition of care patients. It is automatically generated at a patient level, but whenever you want to manually create one, you have that function by going under patient review, summary of care. The output now, and wherever the summary of care is referenced, is now consistently referred to as CCD. And basically, CCD, or continuity of care document, is the electronic summary of care. The auto attaching of the CCD is also now available for transitions of care. So let's say you are transitioning into your care a new patient, and the referring doctor uses an EMR. It could be Prognosis, it could be a different EMR, doesn't matter, but they are also under the obligation of meaningful use, so they are sharing that patient's summary of care with you electronically. So you are getting this electronic CCD message into your Prognosis messages. If they have correctly exported it from their EMR as an electronic continuity of care document, it will automatically interface into Prognosis face sheet to the appropriate locations, such as current medication, allergies, past medical history. Now, if it doesn't automatically interface, that means it couldn't match up the patient based on patient name, date of birth, social security number. In that case, the doctor will receive the message in his Prognosis inbox, as you see here, with the attachments. And in the lower left, the binocular will be enabled. Now, in this screenshot, we see the patient name, but the binocular is disabled and there is a name present. That means it matched it up. If it cannot be matched, there will be no name present and the binocular will be enabled to allow you to go into the patient search, choose the appropriate patient who may have a different name, spelling, or date of birth, and then it will still auto-import that CCD document to the transition of care sections of the face sheet. There is a new tabular report called CPCI for Comprehensive Primary Care Initiative. This reflects standard NQFs. So if you are participating in that CPCI program, you now have the standard report available. This is kind of a moot point now since we're so far into 2015, but all of our meaningful use reports are dual certification supported. There are some UI changes to our meaningful use settings master. I'm not going to go into detail with this here because they're covered in a separate video for the meaningful use webinar itself, but their user interface has changed with regards to labeling, the position of elements, the addition of some new elements, and well as how it crosses over to the EMR system. And then the accountability here on the final page, when you've requested setups through engineering, you can track the status. The certification number is also now available, so when you get ready to do your attestation, you can always go to the help about if you haven't written the number down anywhere. And you can even copy and paste it by highlighting the selection, right-clicking, and then pasting it into the little pop-up. And then a really nice feature here under the Help About screen. For those of you who do use the portals, there's a limitation being an internet-based application that each internet session of a browser on each user's computer can only operate one URL at a time. So when you want to go back and forth between the portal and EMR, you have to have a totally different session going in Internet Explorer. And you can do that manually, but the URL is a very long name that you would have to write down and then type it in exactly when you go to your new session. So we now have a copy and paste functionality. So when you go into this Help About, if you want to open the patient portal, when it says to copy link, click here, you click there. It'll open up the URL for your portal, which you can then copy and paste into a new Internet Explorer session. And the same is true with the referring doctor portal. Now, wrapping things up, some miscellaneous types of enhancements. Under your complaint master, you now have the ability of defining a default assessment and plan. Now, this is explained in more detail in the Setup Complaint Master video, which typically you should be going over when you're first implementing. But if you, again, are a new implementation, hopefully your implementation manager has routed you to those videos. If you're a live client and you want to take advantage of this by predefining an assessment and plan to an HPI complaint level, then when you go under Settings, Configuration, Complaints, you now have the assessment and plan phrases available, and you can attach that to your primary diagnosis that defaults from the complaint. Now, of course, we support multiple diagnoses at a complaint level. The assessment and plan phrase, however, is associated only to the primary ICD. So if you have elected not to default a diagnosis code to the complaint, then this feature would not be available to you. Expressions, you can now create an expression by the patient's type, which you assign under Patient Register. There's a new duration tag that you can embed on reports so that you know the encounter duration, how long it took to complete that patient's chart. This is based on the data entry, of course, of starting and ending time for the patient's care. So if your medical assistant enters the start time when they took vitals, and then when the discharging nurse or doctor writes the end time when they're saying goodbye to the patient, then that will calculate. And if you need that analysis on a report, when you run the report, it will tell you how long it took you to complete it from beginning to end. There's numerous new output tags available. This person, when you're generating reports, will let you know who generated that report. So when you have multiple reports laying around, especially productivity reports, and you want to know, is this Betty's, is this John's, is this Sally's? If you add that tag to the report header, you will know who generated that report. There's quarterly and annual analysis tags. So if within the reports you would like to have those types of data available at a quarterly or annual level, you can appropriately put those codes and those tags in there. And then there's some new tags added to capture last known or no known on the last update. Scheduled process for tabular report. There is a parameters button which allows you to assign which user will receive the confirmation message when a tabular report has been auto-generated. So usually the scheduled processes have to be defined through our engineering team, so you're not going to be going in here on your own. But when you've decided that you need specific reports generated automatically, maybe when you come to the office Monday mornings at 8 o'clock, you like to have specific reports automatically generated so you don't have to sit there and waste your time creating them. So you've had our engineering team throw together a scheduled process for you, and they just automatically run at, let's say, midnight on a Sunday night. But just to be sure that they are confirmed, maybe you want to make sure that the receptionist or the billing manager or the office manager is notified that it was ran. You can do that now by defining through the parameters button who should receive that confirmation message. The logic of review and counter for those of you who are supervising doctors and you need to review your mid-level provider encounters. There are now property level values as to when the message will get sent to that provider. Users now have the ability of updating multiple CVX codes to multiple vaccines at the same time from one screen rather than separately for each screen. So when you go into any vaccine, there's an Edit CVX button that will then bring up every active vaccine in your database so that you can update the CVX codes all at once. This is more of an administrative task, but when we go in to export templates from one library to another, we now have the ability of exporting multiples into a singular export file that will then be uploaded into the secondary URL. Most master file configurations now have an automated audit timestamp on the screen. You see here at the bottom that this was last modified by Dr. Cooper on 9/9/2014. And then some miscellany with regards to meaningful use. Core set 15A, stage 2, fax is an acceptable method to deliver the summary of care when it's not an electronic summary of care. Number 2, patient login icon on patient register is now available at all times for all users and is no longer role-based permission. There's new QRDA3 cumulative report specific for Medicaid and their measures. Patient messages on the document list will now reflect the time zone. The message to drop-down pick list will now display alphabetically. There's a new property that lets you choose whether or not to hide or display results on the document list once the corresponding encounter has been deleted. Because when you delete an encounter, typically everything relevant to that encounter is also deleted. But when it comes to lab and radiology results, even though they display on an encounter when they're entered at an encounter level, they're still saved at a patient level. So some of you may still want to display the results on the document list even though they were entered on an encounter that otherwise doesn't exist. There's an internal provision for importing clinic-level preferred codes, numerous new properties for HL7 exports, which impacts interfaces to practice management systems externally to prognosis. You have a tag to display the brief name instead of the full name on output. You're probably familiar with this if you've done anything with the master file as far as setting up your locations. New property lab order split for Quest is now applicable for Quest eLab if they need you to split a lab order. System-wide, all pick list and multi-select elements for all templates and forms are now modal pop-up by design, meaning it forces a user to make a selection or take an action before closing that window. And then also in design view, an element sequence on a template is now displayed at the template design level for all categories to make managing them much easier. So that is the extent of the upgrade features for version 3 build 2 EMR. As always, we direct you to our resource center if you need any additional assistance. We do have team level emails that you see there in the purple box. You have the self-train options available to you through videos or user quick guides and FAQs, or you can take advantage of logging your own cases, live chat, or live by phone.